Hi guys, so today we're on toxicology now. We'll just start off with the general approach to toxicology. So there are hundreds and hundreds of, or thousands of medications and chemicals that you can get in Australia. It's unrealistic for you to have a photographic memory or to have a perfect understanding of all of them. All right. So we're just going to focus in on some specific ones that you can actually do something about and that you're likely to see. So a little bit of background, you can see that there are over 1,000 deaths, every year from toxicological and poisoning incidents, which isn't that much out of a population of 25 million. But the bottom statistic here is probably the more interesting one. So, this is 4 years old now, and there were still 71,000 ED presentations for poisoning. So this is stuff that you're definitely going to see fairly routinely in your practice. So when it comes to poisoning and overdose, you can separate them into intentional or accidental. So intentional is your self-harms and your suicides, as well as recreational use. People perhaps had a bigger dose than they're expecting of recreational drugs. And then accidental, which can either be long-term exposure, like over the course of a career, or a short-term acute exposure of a very reactive drug or poison. So your general approach, you just follow the normal mnemonic, the DRABCDE that we do for trauma always. However, D for danger, it's very tempting in a normal case to kind of be a little bit flippant with that. Usually on the vast majority of cases, there isn't any danger. But when it's a toxicological or poisoning problem, this is one that you actually do want to just take a moment to have a look at. You can either have unsafe scenes if there's poisons or volatile gases or something around. But if you've got a patient who's overdosed, they can be quite aggressive as well, or have altered levels of consciousness. So you just want to be a little bit more cautious and take your time with D. Response is the same. In poisoning and overdose, you're always going to have airway problems or a risk of airway problems. So you want to pay special attention to that. Breathing, we're going to cover toxidromes in another lecture this week. But this is where you can start to get an idea of maybe the toxidrome you're looking at. So if they're depressed breathing, if they're not breathing at all, if it's very rapid, or if you have irregular breathing like Cheyne-Stokes respiration, which is when the breathing goes fast and then it goes slow and is a little bit just all over the place like that. Circulation, same as always. Disability, again, if we check and there's pinpoint or dilated pupils, it's going to give us a clue as to what toxidrome we're looking at. And we want to expose people, not looking for bleeding or angulated bones or anything like we have been in trauma. Now we're looking for injection sites, fentanyl patches, and chemical odors or chemical spills or burns on the patient. The history taking is really important for overdose and poisoning. So sometimes the people won't be able to talk to you. And if they can't, you want to go and gather medication packets. You want to try and find out from either them or from bystanders on scene what medications they normally take. If you do find packets, don't just try and keep notes of what you found. If that's what you have to do, that's fine. But if you can get the packets, it's great. It means that you don't have any problems with exactly what dose they were taking, exactly when the drugs were issued. You have all that information with you for the hospital staff to look at. Now, the dates of issue is one that we normally don't pay a lot of attention for. Normally, when you look at a drug packet, you're just looking to see what it is. But when there's been an overdose, it's very important the date of issue. So the example that I've given here is that if you have a script that was filled yesterday and it's missing 20 tablets, that's suggestive of an overdose. But if you pull out, empty packets and you go, oh, geez, I wonder if they've had them all. But then you have a look on the back and it was issued, 2 weeks ago, and it's missing 20 tablets. That's less suggestive of an overdose. You still want to investigate that history, but just don't make that assumption without checking the date of issue. For occupational exposure, try and find out the name of the chemical, even though as a paramedic, probably these names, unless you have a background in this area, aren't going to mean much to you. It will assist the hospital with, researching the potential curative agents. Now, children, you want to have a high index of suspicion with children. Adult medications can build up much more quickly because their bodies are so much smaller. Children are very curious, and tablets kind of look like lollies a lot of the time. So they can get themselves in trouble that way, and they may lie about taking the medication. You can't, if you say to a child, did you take these tablets, and they say no, that doesn't really mean a lot. It's likely they just think they're going to get into trouble, and they don't understand the seriousness of the medications they've taken. So, if there's any indication that a child has had an overdose or taken some tablets or been exposed to an agent, just play it safe, take them up to hospital. Now, we're going to cover in another lecture overdoses and poisonings that have antidotes. But the vast majority of overdoses or poisonings don't have specific antidotes, and they require just symptomatic management and attention to the basics. The vast majority of agents, your body is either able to detoxify itself just with some support, like airway support, for a couple of hours, or the fix is quite simple. For example, a chemical exposure, washing the chemical off the patient. But for every single patient who's had an overdose or poisoning, there are some standard things you need to do. And I've put them in italics here. So that's lateral positioning. So if the patient's unconscious, you want them on their side for airway maintenance. ECG monitoring doesn't have to be a 12 lead necessarily. A 12 lead can be indicated, but at least a 4 lead. You're going to get IV access. Doesn't have to be a 16 gauge, but some sort of IV access, and start giving some fluids. Because your liver and kidneys detoxify your blood, anything that that lets you increase kidney output, renal output, like fluids, is always going to be helpful in overdoses, just to help your body metabolize and excrete whatever agent it is. Now, as I said at the first slide, you're not expected to have an encyclopedic knowledge of every agent. So remember this number, put it in your phone, 131126. That's the Australian Poisons line. You call them up, they can tell you all about a poison or a chemical agent or a drug. They can tell you what the expected treatment pathway is and tell you what symptoms the patient will likely develop, which can help you stay ahead of the game.